Hello. Today I will inform you on the different uses of an herbal medicine, medical marijuana. The cannabis plant contains more than 400 individual chemicals. These chemicals' actions in the brain and body are in many ways a mystery. Most studies look into the potential harm of medical marijuana opposed to the potential benefits of medical marijuana. Today, I will discuss some of the potential benefits that medical marijuana provides. Medical marijuana is most commonly taken or used for pain relief in the United States. The different types of pain that it is used for are chronic pain that one can get from, say, having rheumatoid arthritis, which is a disease that leads to the inflammation of the joints and surrounding tissues. Medical marijuana can also be used for neuropathic pain, which is a type of pain that involves nerve damages. So how does it work and what's the effectiveness on the pain? Well, THC chemicals find receptors in the nerves and muscles to relieve the pain, and that's how you get your pain relief. Medical marijuana is more effective and safer than opiates. It can even help with opiate addiction and prevention of said addiction. And in fact, the American Academy of Family Physicians, the American Public Health Association, the American Nurses Association, and even the New England Journal of Medicine endorse the use of medical marijuana for the treatment of severe chronic pain. Next, what else can medical marijuana be used for? Well, you ever heard of someone having the munchies? Well, yes, medical marijuana or marijuana alone do cause the munchies, and it also can help with the munchies and even nausea. It is prescribed to patients who have nausea or lack of an appetite, so it is prescribed to stop nausea and or to induce an appetite. For people who have trouble eating, whether it's an individual who is dealing with genetic factors or emotional and personality disorders. For example, people with anorexia are prescribed a pill form of THC called Myola, and Myola just assists them in the reduction of nausea and a slight increase in induction of appetite. Also, cancer and HIV patients also use medical marijuana to assist with their weight and appetite. It helps them maintain a healthier weight, and it helps with the disease recovery process. And with the disease recovery process, it's important to receive those nutrients. So medical marijuana assists with the induction of an appetite, and it just assists with the disease recovery process that is needed. Medical marijuana works in various ways. As for the cancer patients, there are 2 approved drugs by the Food and Drug Administration, or the FDA. One is called dronabinol and the other is nabilone. They are treatments for chemotherapy-related nausea and vomiting in patients who have not responded to the standard therapy. Also, there is Delta-9 THC by mouth, which is used for patients who have HIV or AIDS, and what it does is it increases their appetite, and it just stops the loss of weight or their weight loss in compared to the patients who take or have taken placebo. Medical marijuana is also used in cancer patients. It helps fight the cancer cells by increasing or strengthening their red blood cells. It is also used for the treatment of certain brain diseases such as multiple sclerosis or MS. MS is an abnormal response of the body's immune system that's directed against the central nervous system, which is made up of the brain, spinal cord, and optic nerves. According to a study in the Journal of Neurology, medical marijuana can relieve particular symptoms of MS, such as spasticity or twitching in the muscles, central pain from MS lesions, and or pain related to spasms. Medical marijuana in the form of pills or oral spray appear to be more effective in reducing stiffness and muscle spasms in MS patients. And of course, like with any other drug, there are side effects such as mood changes and or hallucinations. There is a pharmaceutical version of cannabis or THC that is called Sativex, and it's used as a treatment for the painful muscle spasms that one receives from having MS. And it is currently approved for use in over 25 countries. So how many people actually use medical marijuana? Well, in the United States alone, there are over 2 million individuals who use medical marijuana. The numbers vary state to state, obviously based on whether it's legal in that state or not. I'll have you know though that there are 21 states currently in the United States that have legalized marijuana. As you know, there are many obscured opinions of medical marijuana. The truth is, though, that medical marijuana is not homegrown. It is actually created in a chem lab by scientists. So the stressors of worrying about what is in medical marijuana should be decreased, knowing that scientists actually produce this type of cannabis. It is less habit forming, and it carries virtually no risk of fatal overdose. The benefits may or may not outweigh the costs, but as mentioned, there are uses for medical marijuana.